What's up, beautiful people? Another day, another study. We've talked about pain and low back pain on the channel before. I have had low back pain since I was a teenager. I have some spinal issues that we've talked about. But anyway, let's get into what this study talks about. It's estimated that low back pain prevalence is going to increase and affect nearly a billion people by 2050. And previous study from 2018 identified that a large portion, about one third of the years lived with disability of low back pain are due to three things: occupational slash ergonomic factors, which are things like lifting, forceful movements, vibrations. This often happens in truck drivers. A lot of patients I see are truck drivers and have low back pain because of the vibrations, the sedentary lifestyle, and then things like awkward postures. And then the other two factors are smoking and high BMI. And so this was looking at trends from 1990 to 2021 about what is causing a majority of these years lived with disability due to low back pain. So in 1990, 42.4% of the YLDs were attributable to the three risk factors. By 2020, this had decreased to 38.8%. But when you looked at the breakdown, there were some interesting findings, and the percentage of YLDs due to occupational and ergonomic factors fell, but the proportion due to elevated BMI have increased. And if you looked at the high socioeconomically developed countries like the US, the years lived with disability, the number one factor was smoking, which is decreasing, but it was still number one. And then BMI as a risk factor was increasing dramatically. And so knowing these numbers are important for designing preventative programs and policies. And it's interesting because we've seen with knee arthritis and obesity, the GLPs, specifically semaglutide in this one study, was associated with significant improvements in pain and function in people with osteoarthritis of the knee. And I think that GLPs may become standard of care for patients who smoke, who are overweight, and who have back pain. I've seen this in patients who have these conditions treated with GLPs, that they improve. I've seen people smoke less. I've seen their function improve. So really interesting to see what's going on in this space. And I believe we'll have many more tools now to help these patients than we did previously. And of course, lifestyle is always the backbone of any chronic pain treatment program for at least my patients.